psychological issue of breast cancer management. You know the incidence and the mortality in France. You can look. It appears that this in an increase in cancers in young women without a genetic mutation or other known risk factor. In Greece, you see France and Greece here. Oh. After cancer, it is estimated that more than 2 million people living in France have had cancer. 2 million. How much in Greece? I don't know. You don't. Announcement of anomaly, announcement of a diagnostics, battle. What do we do? Multidisciplinarity before, after, diagnostic, treatment, proposition, organization, personalized care, PPS, roadmap, the end of treatments, the beginning of follow-up with or not hormone therapy, life after, frequency, value of diagnostic time for subsequent experience, the importance of managing anxiety, unknown fear, entry into a disease and its treatment, personalized PPS, to work together, not to be wrong, explain to the patient and her doctor, consist, lying and without rupture. Screening mammography, palpable anomaly, family risk, miscellaneous citation, but even despair where double arise. The notion of anomaly, radiognostic, perception, something abnormal, behavior of doctors or medical staff, the beginning of fear. Very, very bad moment. That is a disease, and that removing the ball is not going to be enough. That is going to take several months, that the treatment will be multiple, that there will be several times and several interlocutors. Isolation, woman. And about the subject, it's important of anxiety, depression, and other problem. But anxiety, depression is very important because anxiety, depression under perception care. Roadmap, tongue successive derailment, chemotherapy, target, radiotherapy, hormonotherapy, possible reconstruction, watching, a whole program that can last more than a year. Personalizing, the objective of personalizing PPAC, managing problem after treatment. Uncertain feeling of abandonment, sequel management, neuropathy, lymphedema, disturbed family dynamic, rehabilitation, return to work, fatigue, memorization, chemobrain, social fragility, observance, follow-up. Caregiver for the patient, and for caregiver, uncertain remission, healing, recurrence, positioning of the local doctor, follow-up, know the recommendation, rat review, patient compliance. Very examined, diagnostic, and post-therapeutic. It's focus that and that for the patient. Gross and net survival, you know, it's good in breast cancer. But what's happened now in psychosocial care for cancer survivor? The name survivor is important. Survivor re-entry period who extends survival, you know, after the treatment. Long-term cancer survivorship or permanent survival after 5 years post-diagnostics. Cancer survivor, the reference term of the scientific community for anyone living with a cancer diagnostic. That's more than 2 million. Repeat, 2 million. Post-cancer of post-treatment to hack the entry into a new period of care, the modality of supervision, access to supportive care and social support. Repeat, anxiety, depression is important. Under perception and depression, post-traumatic anxiety disorder with lymphedema, low level of education, social isolation, medical follow-up, experience as poor. Level and evolution of psychotropic use in patients with breast cancer before, after. Anxiety and depression in cancer survivor is many publications and recent publication. After cancer, a target surveillance. Why follow-up? You are offered follow-up for detect and treat possible late and sequel side effects. Detect sign of a possible relapse or cancer in the other breast as soon as possible. Accompany you to help you regain a psychological, relational, and professional balance. Assessment of medium and long-term after effects. With young women, factors that favor young age, systematic treatment, psychosocial environment, isolation, celibatary, physical inactivity. You see complications after breast cancer, many, breakdown, weight gain, cardiovascular complication, tiredness, genitoury, pain arthralgia, osteoporosis, second cancer, sexual disorder, cognitive impairment, hot flashes, insomnia. The fatigue, very common, important. After adjuvant treatment, persists over time. You see the number here. Weight gain, effect of patient receiving chemotherapy, undergoing treatment, and up 2 years after the end of chemotherapy. Average take observed here. See, number. Pain, post-surgical, medical, neuromuscular, persistent several months after the end of treatment. Solution of acupuncture, mesotherapy, trophic disorders. Discrimination, self-image, self-confidence, relation, intimacy, social and family, and marital with notion looking at its other and discrimination. Reaching femininity. Sexuality, you have here. Psychic and emotional impact, here of reoffending. It is other, I am well-heeled. Integration and acceptance of one's new body image. Feeling different, I will never be the same again, neither physical nor psychological. Physical. Trip symbolism, femininity, sexuality, maternity. Cancer, fear of losing your life. Role of breast in the representation of women. Symbol, femininity, object of desire. The importance of silhouette, cleavage, and premise, more sensual than pornographic. Generous. Discreet. Body meet link. The body and the mind are in permanent connection. A body injury will inevitably have an impact of psychic life, and in particular on femininity and self-esteem. This impact may be more or less significant and more or less conscious. Femininity in psychoanalysis, it is built through the language of the parents. As soon as they know the sex of the unborn child, they will speak it female or male. Although in the language the girl is beauty and sensitivity, and the boy is fighting and virility. As a result, breast cancer attack femininity at the basic of its construction by more defining. The body and its attributes serve as substitute for lack. Language by which a woman will define herself or will be defined in his body, in his desire. Self-respect. It will be acquired at the time of the disease and its treatments. It is a self-satisfaction. It is conscience. It is built on the unconscious image of the body. The unconscious image of body, it is unique to everyone. It is related to the subject and its history. It's living synthesis of emotional experience. An ablation would be an irreversible mutilation of the body, but also of the sense of health. Whatever the prosthetic substitute, the image of the self would be profound change. Social impact. The work. It's important in the work for the woman, convenient working hour. It's very important. The patient asks, converting working hour. So, how do we rebuilding after breast cancer? Physical reconstruction. What is possible? Reconstruction of the breast in reconstructive surgery, social security support, air. What is not possible? Ganglion chain, but with the sentinel is better. Information. Activity physique. Many publications recent, sport activity, vitamin D, etc., etc. Reconstruction psychique. A cope with the attachment of self-esteem and body image. Talking about the test. Start an individual psychological follow-up. Participate in a support group is important. Support group. Get close to competent professional. Hairdresser, swan support care. Breast reconstruction. Each breast cancer is different and with psychological disrupt each woman differently. The relationship to femininity, self-esteem and body image will be changed in a different way in each. We must find solutions and support that are adapted to ourselves. Many publications restoring body image. Yoga, meditation. Yoga appeared to be a feasible intervention and beneficial effect on several physical and psychological symptoms we report. In patients with breast cancer, effect size 1, functional well-being was small, and they were moderate to large for psychological outcomes. I am very sensible because I am hypnotherapist and meditation and therapeutic, comportamental is very important. Psychological reconstruction, the psychic impact will be witness to what has been built up today in the history of every woman. How conscious and unconscious past and present experience will play a major role in the trial of the disease and in the reconstruction of every woman. The absence of the breast, the attachment of the body will have singularly psychological and physical effect. Don't forget the right to forget, patient, the right to forget. Many publications with the work change in embryon statue barriers to and facilitator work in breast cancer, you know, with a survivor. Young women question post-pregnancy, fertility, preservation, neither pregnancy, not breastfeeding increase the likelihood of recurrence after complete treatment of the cancer. Many questions. Consultation, fertility. Listen to us, understand us. A pessimist sees risk in every opportunity. An optimist sees opportunity in every risk. Churchill, conclusion, is a message for the woman. Message. Listen, inform, research. In oncology service center, information, PPAC, specific consultation, major role of the treating physician, outside, patient guide, association, important, recommendation, etc. A group of Amazon in France. Les Amazon, we know in English, Amazon. After breast cancer, testimonials. There is a definite phrase that comes back to this woman. For a while, someone, an acquaintance, a friend, or doctor, said they were lucky. Lucky because breast cancer is healed. It gets better and better. This is all about it, lucky little breast cancer. It could have been worse. No breast cancer, even it is cured. Even if then you never need anything new, it's never a chance. We are simply in good health. It is a chance. These kinds of sentences, they alone can pronounce them. Testimonials. It's important, association patient and réseau, my cancer of Saint Réseau and law speak about this thematic. It's important, the blog, with patient to church, to solution. Sorry for my English.